If you have ever experienced unexplained chest pain, this video is essential for you. Warning: these 10 signs of a heart attack could be your last warnings before it's too late. Imagine being in a situation where your health is at risk and you don't know how to react. Many people ignore these critical signs, thinking it's just temporary discomfort, but the truth is these symptoms can be serious indicators of heart problems. In this video, we will uncover the warning signs that might indicate an imminent heart attack. You will learn how to identify these signs and what actions to take to protect yourself, ensuring that you are prepared to act quickly and avoid severe consequences. This is your guide to staying safe and informed, and the difference between early warning and a potentially fatal event. Don't leave your health to chance. Stay with us until the end and discover how to recognize vital signs and take the necessary actions to ensure you and your loved ones are always one step ahead of heart risks. Your life could depend on knowing this information right now. 1. Swelling in the feet and ankles. Let's imagine a scene. Maria, an active and always cheerful woman, starts to notice that her favorite shoes are getting tight, especially at the end of the day. She finds it odd but doesn't think much of it. Over time, the situation worsens. Now, by the end of each day, her feet and ankles are so swollen they seem ready to burst. She starts to notice that in the morning, the swelling decreases, but as soon as she begins her daily routine, it's back again, increasingly intense. Intrigued, Maria decides to investigate what might be happening. She presses her finger against her ankle and, to her surprise, it leaves an indented mark that takes a while to disappear. This concerns her, and she finally decides to see a doctor. The doctor explains that this swelling, called edema, can be a sign that her heart isn't pumping blood as it should. When the heart becomes overloaded and can't do its job, the fluid that should be circulating throughout the body starts to accumulate, especially in the lower parts like the feet, ankles, and legs. He also mentions that in more severe cases, the swelling can spread to the abdomen, hands, and even the face, something Maria, fortunately, has not yet experienced. The doctor warns that the skin may become shiny and stretched, and this swelling tends to worsen throughout the day, particularly if she spends a lot of time standing or sitting. Maria learns that this sign cannot be ignored. With the right guidance, she begins to take care of her heart, avoiding more serious complications. Now, she is more attentive to the signs her body gives, knowing that sometimes, a simple swelling can be a way for the heart to ask for help. Before we continue, I noticed you haven't subscribed to the channel yet. Don't miss out on updates and potential dangers your heart might face. 2. Extreme fatigue. Experiencing extreme fatigue can be a sign that something is wrong with your heart. Imagine trying to perform simple tasks, such as climbing stairs, walking a short distance, or even taking a shower, and finding these activities to be a real challenge. This kind of unexplained fatigue could be linked to heart problems. When the heart isn't functioning properly, it has difficulty pumping blood effectively. As a result, the blood doesn't carry enough oxygen to the body's muscles and organs. Without adequate oxygen, your muscles and organs have to work harder to perform even the most basic activities. This causes you to feel extremely tired, even with minimal effort. Additionally, heart failure can affect the quality of your sleep, further worsening the sense of fatigue throughout the day. If you begin to notice that fatigue is impacting your daily life and normal activities, it is essential to consult a doctor. This sign may be an indication of heart problems that require specialized attention to prevent complications. 3. Persistent cough. Imagine Joao, always full of energy and healthy, starting to notice something strange. He develops a cough that won't go away. At first, he thinks it's just a cold, but over the weeks, the cough only worsens. Sometimes, he coughs forcefully and notices that the mucus is frothy, and in more serious moments, there's even a slight trace of blood. Worried, Joao decides to visit the doctor, who explains that a persistent cough can be a sign of something more serious happening. When the heart isn't pumping blood efficiently, the fluid that should be circulated throughout the body begins to accumulate. This fluid can end up accumulating in the lungs, causing a condition called pulmonary congestion. Pulmonary congestion causes the lungs to fill with fluid instead of air, leading to a cough that doesn't improve. Initially, the cough may be dry and irritating, but as the condition progresses, the mucus may become frothy and even show traces of blood. This type of cough is not only uncomfortable but is a clear sign that the heart may be struggling. The doctor emphasizes that if you have a persistent cough that doesn't improve and is accompanied by frothy mucus or blood, it is crucial to seek medical help immediately. Treating heart failure can relieve pulmonary congestion and improve the cough. Joao realizes that his cough wasn't just a temporary nuisance but an important sign that his body was giving him to alert him to heart problems. I noticed you forgot to like the video. Show us that you care about the signs of your heart. 4. Cyanosis. Cyanosis occurs when the skin takes on a bluish color, primarily in areas such as the lips, fingers, and nails. This happens because the blood isn't delivering enough oxygen to these parts of the body. Oxygen is essential for all the body's tissues to function properly, And when the heart isn't pumping effectively, there can be a deficiency of oxygen in the blood. When blood circulates without adequate oxygen, it cannot deliver the necessary amount of oxygen to the body's extremities. This results in the bluish discoloration visible in the mentioned areas. This symptom is often associated with serious heart problems, such as advanced heart failure or congenital heart defects, where the heart cannot perform its function effectively. If you start to notice that the skin on your lips, fingers, or nails is turning blue, it's a sign that the situation could be critical. This type of skin color change is an important warning that the heart may be facing serious difficulties and needs urgent medical attention. Seeking medical help is essential to diagnose and treat the underlying condition and improve blood oxygenation. Tell me in the comments what signs your heart has been showing.
5. Palpitations.
Imagine Anna, a woman who has always led an active and carefree life. One day, while going about her daily routine, she begins to feel something strange in her chest. Her heart seems to be beating irregularly. Sometimes, she feels it suddenly racing, as if she were running even though she is not moving. Other times, she notices that her heart is skipping or beating harder than usual. Anna also starts to feel a bit dizzy and at times, experiences a mild chest pain. These symptoms concern her, and she decides to pay attention to what is happening. She realizes that these palpitations don't only occur when she is active. Sometimes, they appear even when she is at rest or engaging in light activities. These palpitations can be a sign of arrhythmias, which are disorders in the heart's rhythm. The heart may beat too fast, too slow, or irregularly, causing a sensation of being out of control. When this happens, the heart might not be pumping blood efficiently, which can result in symptoms like dizziness and chest pain. These sensations should not be ignored, as they may indicate more serious issues, such as atrial fibrillation or ventricular tachycardia, which require medical attention. If you start to experience irregular or rapid heartbeats, along with dizziness or chest pain, it is important to seek medical help. Identifying and treating these arrhythmias can help prevent complications and ensure the heart functions properly. Anna learns that, although these palpitations can be frightening, they are crucial signs that need to be investigated to maintain heart health.
6. Shortness of breath.
Shortness of breath is when you feel difficulty breathing, and it can be especially noticeable when you lie down. If you are noticing that breathing becomes more difficult when you are lying down, it could be a sign that there is fluid accumulating in your lungs. This issue is often caused by heart failure, which is when the heart cannot pump blood effectively. When the heart isn't working well, blood doesn't circulate properly, and as a result, fluid can start to accumulate in the lungs. This accumulation causes the lungs to become congested, making it harder for you to breathe, especially when lying down. Many people with this problem end up needing to use multiple pillows to sleep or even prefer to sleep in an inclined position to make breathing easier. Additionally, you may notice that physical activities that were once easy, such as climbing stairs or walking, become more difficult and tiring. Shortness of breath can worsen over time and not improve even with rest. If you are experiencing difficulty breathing, especially when lying down, it is essential to see a doctor. They can help identify the cause, which could be heart failure, and provide the appropriate treatment to reduce fluid accumulation and improve your breathing. 7. Radiating pain. Imagine the story of Maria, a woman who had always enjoyed a vibrant and active life without any noticeable health concerns. One afternoon, while she was busy in her kitchen preparing lunch, Maria suddenly began to experience a chest pain. At first, the pain seemed like a minor inconvenience, but as it persisted, she realized that it wasn't just limited to her chest. The discomfort began to spread to other areas of her body, her left arm, her jaw, and even her back. This type of radiating pain can be a critical sign of a heart attack. Typically, a heart attack starts with pain in the chest, which can then extend to other parts of the body. Often, this pain radiates down the left arm, can move up to the jaw, or spread to the back. It's not uncommon for individuals to feel a sense of discomfort in these areas, particularly in the left arm, which is strongly associated with heart issues. For Maria, the pain was alarming and far more intense than any discomfort she had experienced before. Unlike typical muscle aches or minor strains, this pain did not diminish with time or rest. Instead, it grew more severe and persistent. In many cases, women experience heart attack pain differently from men, and their symptoms may not always align with the classic descriptions. The pain may be less intense but more widespread or unusual, making it harder to recognize immediately. Understanding the gravity of her symptoms, Maria took immediate action and sought medical attention. She recognized that the spreading pain to her left arm, jaw, and back was not just a coincidence but a potential sign of something serious. A thorough medical evaluation confirmed that Maria was indeed having a heart attack. Thanks to her quick decision to get help and the prompt treatment she received, Maria was able to recover and is now more aware of the signs that she needs to watch for. If you experience chest pain that radiates to your arm, jaw, or back, it is crucial to seek emergency medical care right away. These symptoms can indicate a serious heart problem, and timely intervention can be vital to your recovery and overall health. Recognizing these signs early and acting quickly can significantly impact your prognosis and help you maintain a healthy, active life.
8. Excessive sweating.
Excessive sweating that occurs suddenly and without an obvious cause can be a significant red flag for potential heart problems. If you experience a marked increase in sweating even though you haven't engaged in physical exertion, aren't in a hot environment, and aren't feeling particularly stressed, it may be a sign that your heart is facing difficulties. Here's a more detailed look at why this might happen. The body's response to heart problems can include excessive sweating, which often serves as a way for the body to deal with the additional strain placed on the cardiovascular system. Angina. Angina occurs when the heart muscle doesn't receive sufficient oxygen due to narrowed or blocked coronary arteries. This insufficient oxygen supply can lead to chest pain, and one of the body's responses might be increased sweating. The excessive sweating in this scenario is an attempt by the body to cope with the decreased oxygen levels and the added strain on the heart. When the heart is under stress due to angina, the body may increase sweat production as a way to help manage the physiological stress and attempt to stabilize its internal environment. Heart failure. Heart failure happens when the heart is unable to pump blood effectively to meet the body's needs. This can result in fluid accumulation in various parts of the body, such as the lungs and extremities, leading to symptoms like swelling and fatigue. In response to the additional stress and fluid buildup, the body may produce more sweat. This excessive sweating helps regulate body temperature and attempts to manage the extra burden placed on the heart. As the heart struggles to pump blood efficiently, the body uses sweating as a mechanism to cope with the increased workload and the resulting physiological imbalances. If you notice a sudden increase in sweating, especially when there is no clear cause for it, and if this excessive sweating is accompanied by other concerning symptoms such as chest pain, shortness of breath, or extreme fatigue, it is crucial to seek medical advice. These symptoms may indicate underlying heart problems that need to be evaluated by a healthcare professional. Prompt medical assessment and treatment are essential to address any potential cardiovascular issues and to help maintain your overall health and well-being.
9. Dizziness.
Imagine Joao, a man full of life who has always enjoyed an active lifestyle. One evening, after a day filled with energy and movement, Joao settles into his cozy couch, ready to unwind and watch his favorite TV show. As the plot thickens on screen, he decides it's time to get a refreshing glass of water. But as Joao stands up from his comfortable spot, he suddenly feels an unsettling lightheadedness and a spinning sensation that seems to whirl around his head. Confused, he wonders, "What's going on with me?" Joao's experience is more common than he might think. Many people feel dizzy when they stand up too quickly. To understand why this happens, let's explore what's happening inside his body. When Joao rises from the couch, his heart needs to pump blood up to his brain more vigorously. This becomes crucial when transitioning quickly from lying down to standing up. Under normal circumstances, blood flows seamlessly through the arteries and reaches the brain without any hiccups. However, if the heart isn't functioning efficiently, this process can encounter obstacles. Imagine Joao's heart as a hard-working pump that sometimes struggles to keep up. In cases like heart failure or arrhythmias, the heart might not pump blood as effectively as it should. This inefficiency means that blood flow to the brain can be slower than usual. When Joao stands up, the blood doesn't reach his brain as swiftly as it normally would. As a result, he experiences that dizzy or lightheaded feeling, almost as if his brain is momentarily confused and needs extra time to adjust to the new upright position. For Joao, this sensation of dizziness could be a signal that his heart is having difficulty maintaining a steady blood flow. If this dizziness occurs frequently when he stands up, it's a sign that his circulation might be affected. It's crucial for Joao to consult a doctor to ensure that there are no underlying heart issues. Early diagnosis and proper treatment can make a significant difference, allowing Joao to continue enjoying his active lifestyle without the unsettling feeling of the world spinning around him.
10. Chest pain.
Let's delve into chest pain, a crucial symptom that can signal serious heart problems. Often referred to as angina, chest pain acts as a warning signal from your body when something isn't right with your heart. Imagine this scenario: you're at the grocery store, filling your cart with fresh produce and snacks for the week. After checking out, you grab the heavy bags and start walking to your car. Suddenly, while navigating the parking lot, you feel a tightness in your chest, almost like a weight pressing down on your heart. This discomfort isn't just a fleeting sensation, it's your body's way of telling you that your heart may be struggling to get enough oxygen. Your heart, much like any muscle, requires a steady supply of oxygen to function effectively. When you exert yourself, whether it's lifting those shopping bags or climbing a steep hill, the heart has to work harder. If the blood vessels supplying your heart become narrowed or blocked, the blood flow diminishes, and you may experience that uncomfortable squeezing or pressure. The pain can vary in intensity. Sometimes it's merely a dull ache or a sense of tightness, while at other times, it escalates to a severe, painful pressure. What's more, this discomfort isn't confined to your chest, it can radiate to other areas of your body. You might feel it creeping into your arms, jaw, or even your back, much like an alarm ringing out, indicating that something is off kilter. During physical activity, like carrying those heavy groceries or engaging in a brisk walk, you might notice that this chest pain occurs. Many people find that the pain lessens or completely fades away when they stop their activity. This is because, during exertion, your heart may be temporarily overloaded, requiring a moment to recover. However, it's critical to pay attention if the chest pain lingers after you've stopped or if it starts to happen more frequently. This kind of persistent pain can signify a more severe issue, such as a heart attack. Ignoring these symptoms, or hoping they will just go away, could be dangerous and increase your risk of serious complications. It's essential not to overlook these warning signs. Seeking medical attention as soon as you notice these symptoms is vital for safeguarding your health. Your heart is a fundamental organ that keeps your body functioning. Taking care of it is crucial for your overall well-being. If you notice any warning signs, don't hesitate to reach out to a healthcare professional. Your heart deserves special attention, and you should do everything you can to keep it strong and healthy. To maintain your cardiovascular health and prevent severe issues, it's important to prioritize heart care. If you found this information helpful, please remember to subscribe to the channel and like the video. By doing so, you help spread essential knowledge about keeping your heart healthy and stay updated with more valuable tips. Take care of your heart, and see you in the next video.